All right, well, hello everyone. Thank you for coming to the International Interprofessional Mentorship Workshop. Today we have Jane Sackett and Karen Guilmette speaking to us, and we are so happy to have you. Thank you for coming.
Thank you to have us.
Thank you. So we are here today to talk about...
Thank you for coming.
Thank you. We're happy to be here.
Yeah.
Jane and I work here at the University of Massachusetts Amherst, and we're clinical faculty members in speech-language pathology, working with clients here in our on-campus clinic and educating our graduate students in speech-language pathology. So today we're going to talk to you about language facilitation techniques, as well as some strategies to elicit speech sounds from children.
So my name is Jane Sackett. I'm a speech pathologist for almost 20 years. I specialize in neurogenic cognitive communication disorders, primarily with traumatic brain injury and aphasia and dementia. I'm clinical faculty, as we already said, at UMass Amherst, and academically I teach the anatomy and physiology class and our speech and language disorders class for undergraduates.
And I'm Karen Guilmette. As I also said, I'm a speech and language pathologist, and I have experience across hospitals, schools, private practice settings, as well as here at the university. I have my master's degree from the University of Arizona and also lived in South America in Chile, and I practiced extensively on the border with Mexico in the state of Arizona. So my particular interests are in bilingual multicultural communication, autism spectrum disorder, and social learning. But academically, I also teach phonetic processing here to undergraduates at UMass Amherst. And both Jane and I educate graduate students here within our university clinic.
So the first thing we're going to discuss is child language facilitation. So when you think about language development, children acquire language through various engagement in their activities and engagement in their environments, and specifically with shared activities with other individuals. And then what kids do is they're filtering their experiences through the language. So if you think you've got a child here in the center, any of their experiences or their environment or the context in conjunction with the language that's being used around those experiences and activities and context. These two things combine are how children develop language around their social engagement and their social activities. And so specifically, if you're thinking about vocabulary or learning individual words, rather like when you're thinking about the language and the environment, the vocabulary learning and the word learning is best in highly meaningful contexts and in environments with a lot of context. So what kids do is they map an auditory signal, which is a word for us. They're mapping meaning on that, and it's called fast mapping, but they're doing it based on what they see and what they hear and what they feel and the emotional state. So with the more meaningful experiences and more meaningful context, so if you're talking about, say, fire trucks in the States, if you're talking about a fire truck zooming through a city street, or you're talking about a fire truck putting out a fire, the more meaningful context there is, the more efficient they're going to be at learning that vocabulary unit. And in terms of learning words, nouns are typically the easiest to learn, followed by verbs and then adjectives or descriptor words. So if you're going to facilitate this language development, if you're going to help this language development happen, you think about a continuum of naturalness on how you're facilitating that. So on one end of the continuum, let's say way over here, we have a very indirect method of facilitating language. And that indirect method is very child-centered, and there are not an awful lot of demands on the child. You're just bombarding them with a lot of language. And then higher up on the spectrum of naturalness is something called direct language facilitation, which is a little bit more focused. It's much more direct, and it's much more adult and clinician-centered. So let's talk about indirect language facilitation first. So the indirect language facilitation is typically embedded in a daily routine that they do all of the time. So you look at, or you think about a very unstructured situation, a situation that a child is doing all the time anyways. They're taking baths, they're going shopping with their parents, they're coloring. So if you think about an everyday routine, and then you look at what the child is doing, and the first step to this is just to watch the child, just see what they're doing. And then you interact with that child based entirely on what they're doing, not what you want them to do, but what they are doing. And you talk, and you describe everything that they're doing. You're modeling the language that you want them to see, or you want them to say, excuse me. And specifically what you try to do is model it one step above. So if you've got a kid who's bathing, I want to be clear, in the States, we don't do speech therapy in the bathtub. I don't know why I had this particular picture here, but I want to be clear, we're usually in a different setting. But if you've got a kid who's taking a bath and they're saying soap or water or duck, because we've got a whole lot of rubber duckies back here, what you aim to do is increase the level just one bit. So if they're talking about duck, you say, yes, yellow duck. Or if they're talking about the soap, you're like, soap makes you clean. You take what they say and you're talking about what they're doing. And you take what they say and then you bring it up one level or one linguistic unit. And you model the language that you're aiming for. And you immerse that child in these language models with no specific demands on them. You're really just talking about what they're doing. And there are a couple of very specific techniques. So for instance, number one, you talk about self-talk. And self-talk is narrating what you are doing. So again, you're watching the child and then you're following their lead. But then you're talking about what you're doing. So if you were going to use the example of a bathtub, you talk about putting soap on a washcloth or soaping up a sponge or soaping up your hands, and you talk while you're doing it. You use lots of simple verbs, concrete nouns, and you're aiming for 2 or 3 word phrases. And you just narrate everything that you are doing, and you're immersing them in the language that you're aiming for. The next step up would be something called parallel talk. And that's when you're narrating what they are doing. You watch what they're doing and you follow them entirely. This is all child-centered. And then you talk about what they are doing. They are soaping up their hands. They are holding that duck. Wow, that duck, it's a great duck. Yellow duck. I love the yellow duck. You talk and talk and talk about what they are doing. And then another level to a technique for indirect language facilitation is called toy talk. And you're just talking about what they're playing with. So that works best in a unstructured play activity like coloring or building things or using cars. And you talk about the toys. You label the toys, you describe the toys, like, ooh, red car, that's a fast red car. Your fast red car is faster than my blue car. And you're talking about the specific toys that are in front of them. And then again, you're expanding on what they are doing. So whatever they're responding back to you as, you aim for one level higher than what that is. And there's research to suggest that when you're thinking about language facilitation, conversational talk, just talking about what's going on and talking about what the child is doing, usually facilitates language better than, say, business talk. And business talk, when we refer to business talk, that's telling people, do this, do that, it's over there, say this. If you're telling them what to do, they're getting less language stimulation than just talking about what they are doing. And then you expand on their communication attempts. Whatever they're saying, you aim for one level up. And then you start to make sure that you're doing turn taking. They say something, you say something, and those two things are connected. And even if they're attempting to communicate with you, if they're not forming an actual word, but they're still attempting to communicate you end up imitating the attempt. And you're modeling turn taking, and you're modeling a conversation, and then you're always trying to take their language one level up. So other models for it, or other strategies for indirect language facilitation is modeling. We've talked an awful lot about that. You want to use the language that you want the child to use, but you don't aim towards, you know, the language that you'd expect to see in a 10-year-old. You aim one level up from where they are. So you're going to do a whole lot of baby steps to scaffold them up and up and up in terms of their language development. You also do an awful lot of expansions, and expansion is whatever they're talking about, start describing it. Adding vocabulary units, so those descriptor vocabulary units, or maybe an appropriate simple verb if they're talking about simple toys. You're always thinking about adding nouns and verbs and descriptor words to make their language more and more complex and more specific and descriptive. And then you also always want to be thinking about meaningful contexts. Kids learn language in highly contextualized and highly meaningful environments. And you want to use things that are every day. They're taking baths, they're going shopping, they're playing in the kitchen. And things that are culturally relevant, so different holidays and different culturally relevant concepts. And then lastly, something that's absolutely pivotal to the indirect language facilitation is caregiver training. And there's something called responsivity education, and that's really just teaching a caregiver to watch their child. Oh, look, I got a slide. So teaching a caregiver to make sure that things are child-centered, to respond to all communication attempts, even if it is not the actual linguistic unit that the family or the caregiver is aiming for. You want to respond to that attempt and make sure that they're engaging with their child. And it's wholly child-centered. It's not what the adult's aiming for, it's what the child is talking about. And then also teaching the family to not only watch the child and follow their lead, but also narrate what they're doing. So teaching the family to do the self-talk and the parallel talk and the toy talk, and start adding in nouns and adding in verbs. And then when you think about the transactional effects, when caregivers are modeling the language, the child increases their language to that output. And then you do it again. So then caregivers increase the complexity of that model, and then the children increase the complexity of their output. And you do it in small stages. You model something higher, the child goes like that. You model something higher, the child goes like that. And research suggests that language development is small baby steps, and it's in relation to the language that's being modeled for the child. So that's an awful lot of indirect language facilitation. There are no demands on the child. You're just talking about what you're doing. You're narrating what they're doing. You're just bombarding them with age-appropriate, developmentally, and culturally appropriate language use. The next step is something a little bit less natural, and it's called direct language facilitation. And direct language facilitation is significantly more focused. It's language stimulation that you're aiming towards one particular linguistic structure, or maybe two or three. And what this requires is selecting a language structure that you're interested in. So what you've got to do is have some sort of a systematic assessment of what the child is currently using and what they're using successfully, what's emerging, what they use sometimes successfully and sometimes not, and then what the child doesn't have at all. And what you want to do is have some sort of a systematic assessment of that. So you've got information about where they are in language. And then for the direct language facilitation, you choose one of those, and it's highly individual. So you choose nouns or verbs or descriptors that the child does not have yet. And then your language facilitation is structured or targeted on those language concepts that the child does not have yet. So you can do this in a very structured clinical fashion. You also do an awful lot of caregiver training, again, so that there's home programs, so that you're training the caregiver to, if you've identified these 2 or 3 language structures that the child needs to work on, give the caregiver some ideas on how to do that. So, you know, next time you go grocery shopping, I've noticed that your child's having a tough time with labeling colors. When you're grocery shopping, why don't you label the yellow bananas and the red apples and the green bok choy, so that you've got a very naturalistic, highly contextualized and meaningful event to directly target the language structures that the child's having a tough time with. So what you also want to think about is, with those meaningful contexts, you need a variety of meaningful contexts. So if the child is doing it with you in a very clinical setting, really working on color words, you also want the child to do it with their caregiver if they're going grocery shopping. And then you also want to do it at home when they're coloring, so that you've got a variety of highly meaningful and contextualized situations where you're targeting the same very structured language facilitation. And then what you need is lots and lots of practice and a theme and more of a theme-based meaningful activity. So again, if we're talking about color words, then you're using them in a variety of different contexts or a variety of different themes that are highly meaningful for the child. So specific techniques are using forced choices. So for instance, if we're talking about for the grocery store and you're talking about the yellow bananas and the child's still having a difficult time identifying or using the word yellow, you can say, is that, you know, are those bananas yellow or are they blue? So you've given them forced choices. It's much easier to recognize the right answer than to independently produce the right answer. So you're always aiming towards making sure that the child is successful. So with a forced choice, now they're just going to recognize the right answer. And you can even use your body to tell them, is that a yellow banana or is that a blue banana? So that you can use their body to make sure that they're successful. Another technique for direct language facilitation is thematic activities, making a picture book about a concept. So using calendars and family photos to talk about the past. So if you've got a child who is having a tough time marking their verbs to denote the past, using old photos, old family photos, to talk about what happened last holiday or what happened 2 or 3 years ago. So you've got a calendar to give them some structure, and you've got family photos because they're highly meaningful and the child already has that knowledge base, and now you can embed a very structured language concept in that. Another thing that's pretty consistent in terms of thematic activities is access to culturally relevant food. Our grocery stores have circulars, so they send out these ads of what's on sale and what's in season. And so just having those in a clinical environment and talking about things that are culturally relevant and meaningful. Another technique for direct language facilitation is recasting an utterance. And what that means is repeating an utterance or repeating what the child just said, but with the accurate syntax or the vocabulary that you're aiming for. So if they're not marking a verb to denote like past tense or future tense, then you would just re-say it without any criticism, just say it out loud with the accurate syntax. You don't make them repeat it, you just say it out loud, you recast the sentence so that they're surrounded and immersed with the level of language that you're aiming for. We already talked a little bit about fast mapping, and fast mapping is how most kids learn vocabulary units. So learning nouns and verbs based highly on meaningful context, a lot of photographs, a lot of pictures, a lot of thematic units. Also categorization. So when you think about think about learning nouns particularly, you have like subordinate categories. You've got like, or excuse me, superordinate categories like fruit. And then you've got all these examples of different fruit. And so what you want to do is help them categorize things, because your vocabulary is kept in semantic categories. So you want to maximize how they're learning based on how your brain organizes the food or organizes the words. So you want to aim for categorization and thematic units. So you do a chunk of fruit, maybe you do a chunk of transportation, maybe then you do a chunk of clothing, so that it's categorized and you talk about the superordinate and then the different exemplars or the different examples. And then you talk about how they're associated with each other, so that you're always building these maps and these semantic associations with the vocabulary units. And then the last thing I wanted to show you about for language facilitation is books. Using literacy is great for a number of reasons. And these are some books that we have in the US, and that I think that you probably have similar type books that are highly repetitive. And highly repetitive is excellent for consistent and frequent language input. So they're books that say the same things over and over and over again. So this top one is Brown Bear, and that book says, brown bear, what do you see? And then it talks about a goose, and then you turn the page and it says, brown bear, what do you see? It's highly repetitive, and it's consistent, and it's a really nice model for sentence level, or at least upper phrase level language, so that the child is getting that entire unit. And using books that have repetitive and consistent language in them is a really, really nice way to I guess, reinforce the language that you've been showing them in treatment. And also it's a really nice way for caregivers to do direct and indirect language stimulation at home when they're reading with their children. Yeah, so that's what we have about language facilitation. Are there any questions about language facilitation? Karen's going to talk about speech sound elicitation in a second.
So you're going to have to take yourselves off of mute if you have a question, because I mute all of you while the presenters are speaking. So please go ahead and unmute yourself if you have a question, or type it in the chat box.
Kate, I don't see the chat box. Am I supposed to have it?
It's at the bottom. I'm monitoring it. So I will go ahead and I will just interrupt you if someone has a question.
Okay, fair enough.
Great, we'll move on then. Okay, so now we're going to talk about speech sounds. So we've spent some time discussing language. Now we're going to talk about how we can help children to produce the sounds that are required in their language for them to be well understood by those around them. So in order to do that, it's important to think about how kids typically acquire speech. And at least in terms of English, the English consonants are acquired typically on average between ages 2 and 6. Now that's the average. Most kids, about 90% of kids, have acquired all of the speech sounds that they're going to develop by age 8. But on average, it's between the ages of 2 and 6. So the vowels are acquired first. There's lots of vowels in the English language that are produced differently. But there's also several different types of consonants. And the consonants in the English language are thought to, they use a way of describing them as having 3 different components, 3 elements. One is where it's produced. So that would discuss where the tongue is placed in the mouth, essentially, to produce a particular consonant. Another is whether your voice is on or off when you produce those sounds. And the last is where there's a constriction, the manner in which it's produced, And so that also has an impact. So there's lots of different variables that kids need to consider when producing sounds, and most of this develops naturally over time. So typically, if we look at norms for speech, this is a visual that you can find on the internet. Let's see, oh, it's gonna ask me if I can open it here. And what you see is for English consonants, children's speech sounds, you can see the ages that they're typically acquired. So the TH sound in English, the voiceless TH, as in the word thumb, is the last sound. And then there's several other sounds below that down to the easiest sounds that are first acquired at age 2 to 3, which are a lot of the sounds that are produced you know, bilabially with the two lips, for example, towards the front of the mouth. So it just depends on how those sounds are produced and how complex they are, and whether or not they're traditionally part of babbling that children tend to do at an early age as to how they develop these sounds. So that's the general order in which English consonants are acquired. But typically, and we do see this clinically, R and TH tend to be the hardest for children to acquire in the English language. But some of the other sounds, you know, may be atypical in individual children.
Karen, we're not able to see the treehouse visual because it kept on the PowerPoint screen.
Oh, so how do I do that?
So you would have to go back to the share box if you're going to continue to talk about the treehouse visual. If you're not, that's fine. Everyone can go on the PowerPoint and look it up.
Perfect. Why don't we do that then?
Okay.
Okay. Sorry about that. I do have one other. Now, how do I get back to the PowerPoint? Hold on. There we go. Okay. I do have one other link as well, so we can see if we can share that when we get there. Another thing that's important to note when you're talking specifically about language, but also about speech, is to think about if you have bilingual or multilingual populations, that it's definitely important to consider the impact of 2 or more sound systems. So we're not just talking necessarily about the consonants and the vowels produced in one language, but rather we're talking about how they might overlap and how they might have unique sounds and different rules for how they're produced. And it's very possible that one linguistic sound system could influence another. So one of the things that's really important for professionals to do, so as speech language pathologists, we have to be very careful to assess whether there truly is a speech sound disorder or whether there's simply a difference due to dialect, accent, or transfer between languages. So that's really important, that we don't want to be calling a child who speaks differently due to an accent or a dialect as having a disability or disordered speech, but rather they just have a difference due to their linguistic background and the exposure that they've had to multiple languages. That being said, as speech language pathologists, sometimes we do see patients who voluntarily would like to work on dialect or accent, but that's certainly not something that we're doing from the perspective of it being a difficulty or a challenge that's based in a disorder. So if we are talking about atypical speech sound development, so speech sound disorders, we might be talking about articulation. And articulation is when a speech sound difficulty is related to the motor production. So how the child is moving his or her articulators within the mouth, how they're moving the components that are required to produce speech in their mouth. So for example, one of the articulatory difficulties that a child might have in English is the distortion of the S sound. And you may have heard this described as a lisp. So sometimes in common terminology, people will call it a lisp. And that can either be that the tongue is moving too far forward and pushing too much air out the front, and it could be a frontal lisp, or they could be flattening their tongue out and having air leak out laterally on the sides. So then it sounds slushy, or it doesn't sound as precise as we might be anticipating to hear with that particular sound. But a speech sound challenge could also be phonological. And if it's phonological in nature, it's related more to language, to the linguistic aspects of speech production. So all of our language systems have different rules for how sounds are produced based on the context in which the sounds come in different words. And so there can be groups or patterns of errors that are present if a child has a phonological difficulty. So for example, there might be an entire class of sounds that are usually produced further back in the mouth, like the k or the g sound, but the child might be moving those sounds further forward and producing t and d for those sounds. So that is something that we might call fronting, because they're moving entire classes of sounds further forward. But it might be really difficult sometimes to distinguish between whether or not the child is experiencing difficulty with the motor production or with the language and the linguistic aspect of speech production. The other thing that all of you as occupational therapists or physical therapists might also be thinking of is apraxia. And so sometimes apraxia of speech, which is a speech motor planning issue, is also something that would be categorized as a speech sound disorder. So that's also something that also can be treated by a speech language pathologist, but all of these things can be difficult to distinguish at times, and some children exhibit errors across all of these categories. But how we might treat this would differ depending on what those underlying deficits are. So we do our best to be very thorough to differentially diagnose what those underlying deficits might be so that we can come up with the appropriate approach for treatment. So with articulation, we might target each speech sound deviation separately, but a phonological approach would target groups of sounds that have similar error patterns and try to work on several sounds potentially at one time. So overall, the treatment process, our goal is to improve speech intelligibility. So speech intelligibility is how others are understanding the child's speech. And we're expecting by about age 4, we're understanding most of what a child is saying. So we need to establish that the child can produce the sounds that are required for them to be understandable to others, for their speech to be intelligible. So the first thing we're going to try to do is during the establishment phase, we're going to try to elicit sounds or help the child to produce specific sounds and then stabilize that production. The next thing we're going to do is move to facilitate carryover from a specific sound to a syllable, to a word, to a phrase or a sentence, and eventually to conversation. And then finally, and perhaps most importantly, we really need to focus on generalizing those skills. So we need to make sure that we make production of the sounds more natural, more automatic, and we need to encourage the child to self-monitor and start to independently correct those errors. So the first thing that we think about is, what types of words should I start with? What types of sounds should I start with? And so there's different ways to think about that. One of those things is to think about using a developmental approach, which is really the most traditional approach. And it's based on that treehouse visual that you did not see, unfortunately, based on the order of typical acquisition, when we would expect children to acquire particular sounds. So we'd start with the earliest acquired sounds, and then we'd move from there onto sounds that are more challenging and typically acquired later on. So a non-developmental approach actually is based on the more recent research though, and one of the more commonly used approaches lately is called the complexity approach. And here in the clinic, we call it doing the hard things first. So we are choosing the most difficult targets first, with the idea that choosing those targets has been shown through research to have an effect on a cascading effect to generalize to those easier sounds, the sounds that were acquired earlier on a developmental stage. So that's one way that we like to think about it, because it gives us, for lack of a better way to describe it, more bang for our buck, because we work on some of the harder sounds, and oftentimes it has a cascading effect down to simpler sounds. Another way to think about it that we often do as well is to think about a client-specific list of words. So words that are really functional and are chosen based on relevance to the child. And oftentimes we might start with something like the child's name. Perhaps the child's name, unfortunately, has sounds that are quite difficult for the child to produce, and they're asked to say that word over and over again, and it's frustrating for the child. Another sound we might choose that could be client-specific would be, perhaps we want to choose something that is more visual. So a sound that's produced in the back of the mouth may not be visual to a child who's a real visual learner, whereas the sound that's produced at the front, at the lips, might be much easier for that child to see. And so it might be easier for them to try to imitate that sound when you're first trying to elicit it. Another way that we might think about it is the degree of deviance. So if there's something that's completely atypical that most children don't do, and so listeners are not expecting to hear those types of errors, it can have a very, very large impact on their overall speech intelligibility. So in English, it's not typical for a child to drop off the first consonant. So even very young children tend to have the first consonant and then the vowel when they're babbling. So if we start to hear a child that isn't putting the first consonant on words, it's really hard for us as listeners to even have the slightest idea of what that child is trying to say. And so if we can start to help that child to replace those sounds at the beginning of the words, it can have a huge impact on their overall speech intelligibility. So there's lots of different treatments out there in the literature, and we won't go into them in too much detail, because I know really what we want to get to is what are some techniques that we can do and that we can talk to caregivers about them doing on a day-to-day basis to help their children with some of these sounds. But just to provide context, there are treatments such as phonological contrast. And with phonological contrast, we're really focusing on groups of words that differ in a certain way. And so we might do minimal pair therapy, where we might show the child the difference between a key and T. And so we're emphasizing that just that one sound at the beginning of the word changes the meaning dramatically, and it's very important that they recognize that. There's also another phonological contrast called Maximal Opposition, and that's where it's taking all of those different elements that I talked about with place, voice, and manner for English consonants, and it's looking for the sounds that are the most opposite to make that maximal difference apparent for children. And so they might then compare two words that are maximally different as well. This works in line with speech sound perception, where we need to help children to recognize the difference between those two sounds. Because before they're able to produce them accurately, they have to recognize that they're producing a sound differently than the way it's traditionally produced. And so we might spend a lot of time at first helping the child to understand the speech production of others and helping them to really highly emphasize those sounds so that they can recognize when it's produced in error, and that error production actually has an impact on the meaning of the word. And another strategy that's used for that is called auditory bombardment, when you provide the child with a lot of different words that have that same sound. So they are then listening to those words and understanding the importance with the emphasis on that sound, so that they then hear how that has an impact on the production of the sound. Another strategy, a treatment framework, is to use core vocabulary, and that ties back to when I I talked more about child-specific words. So here we're going to think about, maybe have the caregivers give us 40 words that would be particularly meaningful to that child's life. And we're going to focus on the whole word then, as opposed to a single sound, and really work on helping them to acquire those words in a way that is helpful to their communication with others. There's another treatment approach called cycles. And in this treatment approach, basically you're targeting different sounds for periods of time. So you might start with simply working on S, and you might work on S for 4 to 6 weeks across different places of the word and in simple phrases, and then move on to a different sound. Then you might start T and do that for a period of time. And this approach helps the child to have some in-depth knowledge of each of those individual sounds, but moves on perhaps before those sounds are fully generalized, so that it moves from one sound to the other rather fluidly, and helping the child to recognize that all sounds matter. There is another treatment approach called metaphon, which is thinking of the meta phonological awareness, or the different components of words from a broader perspective. So that might focus on whether or not a sound is voiced or voiceless, whether we turn our voice on to produce a certain sound or not. And then finally, a naturalistic intervention is much more along the lines of what Jane talked to us about previously with the indirect approach to language facilitation. Here, we're really emphasizing sounds that are produced in error, but we're doing it in a much more natural way. So if a child has a favorite restaurant or a favorite book or something that they do frequently, we might use a menu from that restaurant and really emphasize and highlight those sounds that they're working on. We might use a book that is repetitive, as Jane mentioned, but also that has a repetitive sound over and over again. And as we work with that child and read the book to that child and point out different pictures and ask questions, we're going to emphasize and saliently point out the places where those sounds are being used in conversation, in words and pictures, whatever we're pointing to and emphasizing. One thing to point out, and I think one of the reasons why I included this is because from what I understand, most of you are thinking about a lot of this from a motor perspective, I might imagine. And so one of the things that sometimes comes up in the area of speech and language pathology is whether or not we should be doing oral motor training prior to teaching sounds, like blowing exercises. Should we have children use kazoos and, you know, blow air into different types of horns? Should we have them, you know, use a straw and blow a tissue across the table? Those types of things. And so while exercise programs can be really helpful for certain muscles, tongue strengthening is usually not required. So really there's a lack of evidence that such treatment is appropriate for improving speech sound production in the absence of emphasizing speech. So you can do many of those things as long as you're also saying that yes, we need to put our tongue in this position because that's what is required to produce this sound. So there's no strong evidence that says that non-speech oral motor exercises by themselves are going to have an impact specifically on speech. But they certainly can do other things in terms of oral sensory function and preventing oral aversions from developing that many occupational therapists may be doing in conjunction with a speech language pathologist with feeding therapy. But isolated oral motor exercises to increase the strength of the oral musculature or improve speech, there hasn't been any concrete evidence to show us that that necessarily is effective. But of course, they may be indicated for other difficulties. So we have been seeing a child lately here in our clinic who had a cleft lip and palate repair and was unable to move his tongue up to where it needed to be to produce sounds. So of course we were working on helping him to acknowledge and recognize that his tongue can move. There was no reason from an organic perspective that it couldn't. And he needed to do that and raise that tongue in order to produce the sounds we were discussing. So what are some very specific techniques and strategies that we can use to help children produce sounds? Well, one that's really helpful is using visual feedback. So we might use a mirror to show the child where to place their tongue, where to put their teeth on their lips, for example. We might mold Play-Doh or clay to help them understand the shape of their tongue. We might use some videos or other images and pictures to help them see that as well. And we often use mouth puppets. That's really helpful in helping a child to spend some time thinking about what these articulators are doing. Sometimes we even come up with images and pictures that we can use again and again. For example, if we want the child to keep their tongue behind their teeth, we might talk about the tongue being, caged in, and we might have all sorts of zoo animals and other types of things that we're referencing to help them have imagery to think about where their tongue should be placed. We also might use gestures. So when I talked about the placement, I also talked about manner for some consonants. So some consonants need a lot of air to be blown out, like the S. So I might hold my hand out to help the child recognize that it needs a longer sweep to keep that air blowing. And I might do a short chop to make sure that they understand t stops right there. Because actually, if you continue blowing out air for T, it's actually going to become the S sound. So sometimes we need to be very specific and use some gestures to help the child to understand that the T produced in rapid succession with the air held out becomes an S. So we want to make sure that they cut that off. We also want to help them to understand whether their voice is on or off. So we might have them touch their neck and feel their voice box. Similarly, with more tactile biofeedback, we might actually put items inside the mouth to provide correct tongue placement and coordination. So oftentimes you can do that with a lollipop. So if you wanted the child to put their tongue behind their teeth to produce that T or D sound, we might put a little bit of flavor with a lollipop in that exact spot and ask them to lift their tongue to that alveolar ridge, the ridge behind the teeth, so that they're able to place their tongue in the correct place. If we're working on something like R, where we need them to move their tongue back and bunch it up, we might take a floss pick and push the tongue backward to help them feel the accurate placement and the bunching of that tongue. Perhaps if we're trying to help them produce the sound for L, the O, we might have peanut butter on the roof of their mouth that they might run their tongue back over on their roof of their mouth to help produce those particular sounds. And then certainly we can use tongue depressors and other types of things to gently place inside the child's mouth so they have an idea of where to move their tongue to for the production of certain sounds. And then to increase their ability to understand speech sound production and to self-monitor their own productions, we might use audio feedback. So we might have a recording and have them play back those productions so that they can assess whether that was an okay production, a better production, or their best production, and have them categorize the sounds that they're producing correctly and those they're struggling with for perceptual purposes. And if you have access to fancier equipment, which even we don't have access to on a day-to-day basis here, but they do in some scientific labs, sometimes they'll use things like ultrasound to watch the movements of the tongue, other types of more technologically advanced feedback. They might use spectrograms so they can see the noise that's present for certain sounds. But again, that's not typically used on a day-to-day basis and less likely with children than it might be with older patients. So one of the things, though, that's really a great idea to do with younger children is to teach them a little bit about the anatomy of how we produce speech. And so there's this concept of the speech helpers. And so I'm not going to click on this link, both in the interest of time and because then I'm going to be technologically challenged here. But you can click on the link, and there's lots of different things that you'll see out on the internet that speech language pathologists and teachers have created for this concept of speech helpers. So the idea that we have to use our tongue, and we have to use our lips, and we have to use our lungs, and all of the different parts of the body that are used to produce speech. And so there's lots of child-friendly activities to help them identify those parts. And then we can have them use that terminology, and we can use shared vocabulary to say, oh, what about our speech helper? We were supposed to have our lips engaged there, and we can help them to use a common set of words to help us all identify how to produce different sounds. And when we're talking to parents about how to work with their children, or any caregivers, even when we're talking to teachers and other professionals who might be working with children, it's really important that we think about how they are interacting with kids who have trouble with speech sounds. So we want to make sure that it's only gentle reminders of correction if it's directly addressed. So instead, much like what Jane was talking about with language facilitation, for speech sound elicitation, we simply want to say the sounds correctly, but we don't necessarily want to do it in a punitive way. So we want to acknowledge the production and the attempt at the production. So if they misproduce a particular sound, we'd say something, if they said nana for banana, we'd say, oh, you'd like a banana? And we just emphasize the sounds that were produced in error, or the components of the words that were left off, but we wouldn't necessarily point it out to the child directly. When they are successful in starting to produce sounds well, we want them to try to practice those sounds at home for 5 to 10 minutes a day. But we don't want them to practice the sounds that they're still struggling with, because as you all know, in terms of motor practice, if I am practicing something continually in error, you know, if I am trying to improve my basketball shot and I'm constantly moving my elbow out to the side when I shouldn't, if I practice that unsuccessful attempt over and over and over again, it's not going to be helpful in having me break that motor pattern and that habit moving forward. So we really want to emphasize practicing sounds that are emerging and are successful at home. And again, we want to model the sounds during daily routines. So much like Jane was talking about with bath time, we also want to talk about the sounds in the same way. So if the TH is a word that the child is having difficulty with, I can really emphasize that during bath time and think about all of the different ways I can emphasize that sound over and over again just during natural conversation, as I'm narrating from a language perspective what's happening during that bath. And similarly, reading. So I really want to emphasize those sounds when I'm reading. I might pick books that I know might have sounds that I want to emphasize. And the same thing when I'm playing with my child. I want to take that opportunity. And I want to congratulate and emphasize correct production of the child's targets. So if a child knows they're working on a particular sound like S, and I hear that sound produced and produced well, I really want to make sure that I acknowledge that and the hard work that's gone into that. Using positive and very descriptive words. Wow, I know you were working on keeping your tongue behind your teeth. I love how you did that. I didn't see your tongue at all. You know, being very descriptive about what the child did and what the child did well. And the reason it's important for us to think about this from an early intervention perspective and ongoing support to make sure that children generalize their skills is because this may result in persistent speech difficulties if not addressed, and difficulty communicating effectively when speaking, which can obviously have vocational and educational impacts, difficulty acquiring reading and writing skills. Sometimes children who have significant phonological challenges with their speech production are much more likely to be at risk for reading and writing. And the psychosocial problems. So it's not just about the academics, but also about the emotional and social elements of having difficulty producing speech accurately. And it can lead to low self-esteem and potentially the increased risk of bullying. So we definitely want to think about recognizing when a child is struggling and working to help the child as early as we can. And I think that is all.
Well, I have a question for you before anyone else. I get asked all the time, if how many words are you expecting at 1? How many words do you expect by 2? I heard you say that you expect them to be mostly intelligible by 4, but do you have some guidelines as far as like how many words by 1 and how many words by 2?
Yes, and so it tends to differ for bilingual and different cultural populations, I must say. So I also spent some time, working on, in the Navajo Nation in the Southwest, and so it differs. So they can vary. So that's the first thing I want to say. But certainly, we're expecting a minimum of about, let's see, by age 4, it's like 500. Right, I was trying to think of the older ones, like 100. Yeah, I can't think of so really, because it differs so greatly based on the language and the cultural paradigm, it's really hard to give an exact number. But I guess the most of them say that early on, by 1, you're only going to have a handful of words, so 10 maybe. And a word that you're going to have might not sound like a word. It might just be that every time the child is producing ba, it means their bottle. So again, it might not necessarily be a specific word, but every time that particular semantic unit is produced, it means something specific. By age 4 or 5, you're looking at thousands of words. So it's starting off quite slow, and then it's moving, from 10 to 100 to 200, and then it significantly jumps up as you get to age 4, 5, and 6.
Okay, so you would say by age 2, approximately
100 words.
100 words. Okay, thank you.
Yeah, but
Does
again,
anyone else?
that's more for mainstream production, I guess I would say, in the United States.
Okay. Does anyone else have any questions? Be sure to unmute yourself before you ask a question, or you can type it in the chat box and I'll relay it.
Hello.
Hi, Victor.
Yeah, thank you for the presentation. I just want to ask about autism.
Okay.
When you have achieved, the kid has started saying something. How do we maintain this such that this child keeps on saying something more meaningful than what you were saying before? Okay, this scenario, like the kid has been saying something, like making a sound, but then from that sound, you get to teach this kid to say something meaningful, and then you'll find that he says it, but afterwards, or after some days, it stops and he goes back to what he has been doing previously. So I'm looking at such, how do we teach this kid to maintain a meaningful say that he has been, that he has gained?
That's a really good question, and that comes up pretty consistently with autism. And I think one of the things that's most important is to make sure that it is being communicated with the caregivers and the other people in that child's environment. So if, for example, you've been working on a specific word and it is, the word for cookie, and he has, a favorite toy, we have a child in the clinic that I'm thinking about
whose favorite toy is Cookie Monster, which is a character from Sesame Street. And so if that child is saying cookie or approximating something that makes us think cookie, if we know that that's what that means and the parent knows what that means, but then the child goes to school for a significant portion of his week and is saying that word and is not being acknowledged that that means Cookie Monster, then they've found that that word is no longer meaningful. It's lost. They're going to lose the motivation to use that word if it's not recognized by everyone in his or her environment. So I think first and foremost, it's to recognize that communication, there needs to be an underlying motivation to communicate and a recognition that when something is communicated, that it's acknowledged and those communicative attempts are acknowledged. Because if they aren't, the child is going to find that it doesn't seem to serve his or her purpose, and they might then stop progressing in terms of how that speech is used. And I think specifically with autism as well, we also want to make sure that as they're acquiring more language and more speech, that we're also using augmentative communication. So whether that's simple pictures or something more complex, so that we're always modeling for the child additional language and providing those children as well with a way to report back and to communicate themselves expressively while they're still working on their speech and language skills from a verbal perspective using their mouths.
Oh, thank you. Another question. I'm sorry about my background. It's noisy.
No problem.
Okay. Yeah. The other question is about I have a child with CP, and when you spend time with him, like right now, the family can understand what he's communicating. I can understand what he is communicating, though when he's speaking, the words are not clear. But the challenge is when he goes to school, he looks like he is deteriorating because even when he tries to communicate, they do not understand, they do not get what he's saying. He has the communication, like when you look at him, is this person who you see like he knows what he wants to communicate, but he cannot pronounce them audibly. So I'm looking at how can we, in such a scenario, train this kid on how to bring out these words such that in any environment that he happens to go to, they can pick up what he's saying than only referring back to the mother or to the therapist. What is he saying? Like, how can we bring out this audibility? Is there something specific that we can do to help this child to speak out such that the words are clear?
Right.
Thank you.
So I think what's hard is without knowing why his words aren't clear, it is difficult to think of a specific suggestion. But what I would always say is that it is typical that children who are less intelligible in their speech are well understood by people who are very familiar with them. Because, you know, as parents and as professionals that work with those kids on a consistent basis, we might understand what they say, but less familiar listeners may not. And so that's where, to reduce frustration, we'd want to make sure that we had some visual support. You know, Jane was talking about those forced choices with language, but with speech, we'd want to have visuals as well, pictures or something to provide context, because when we have context, we're more likely to understand what the child is saying. And then once they recognize that, important things to note or to work with them to open their mouths wide if that's something that isn't happening, removing their hands from their mouth, which sometimes can be something that children who are used to not being understood do.
because from a social perspective, they're nervous that they're going to be misunderstood, and they have that in their mind that they might be. So if they feel comfortable having photos there, they might be more confident to speak up, to speak more slowly, to emphasize certain sounds, and to remove their hand from their mouth if that's something they do in terms of their nerves. So while I can't comment on specific speech sounds, I would say that slowing the rate, asking them to over-articulate, and modeling the words that they're producing in error for them, and providing picture support to provide context are good ways to start.
Thank you, Karen. Arawolo has a question too, but Arawolo, you have to take yourself off of mute.
Thank you. I'm Arawolo from Nigeria.
Hi.
And thank you. I joined in about the end of the lecture, so I didn't get much of the starting point. My question, I actually started typing it already to Kate. So let me just ask. I have a child, an 11 years old autistic child or client, not my child, my client. And the problem I have with this child is there are so many people at home where he lives. So different forms of communication, the nanny, the grandmother, the cousins, so many people at home. So each time I give instructions about communication, the way it should be communicated with, there is this difficulty following the instruction because he has so many people communicating with him almost at the same time. Some will be so harsh on him, some will be mild. So he's confused. He doesn't even know what to do. Most of the time, he speaks, all right, but though not audible enough, but he speaks. Now we are working on making requests. So making requests like, can I have a drink? May I go to the toilet? Can I have my food now? He's having difficulty because I teach him in English, and most of the time people at home speak the local dialect, and I don't know, what shall I do in this case to make communication easy for him?
Well, I think that's a challenge that I will say is probably oftentimes felt across different countries, because that's something that we come across frequently as well, is that it's really hard to make sure that the plan is consistent from home to school to the clinic, into all aspects of the child's life. And I think that trying to get the team on board and finding ways to have communication that works with the most people involved in that child's life, and emphasizing the importance of having consistency there, is obviously the first step, but it's not always possible, and we recognize that. So I think with the different languages that the child is exposed to, maybe it would make sense for, again, there also to be some visuals that are used to also support those requests. Because I think that if the child has access, for example, to a communication board that has a lot of the requests that he makes on a consistent basis, that perhaps he can use that in conjunction with speech. And that might help bridge any of those gaps that come up. But what's most important too is that the people in his environment continue to communicate with him in the language or the dialect that they feel most comfortable with. Because a rich language environment for any child is really important. And one of the things that I sometimes see when I work near the border with Mexico is that sometimes family members who don't have a real clear understanding of English will try to use English because they think that's what's expected. But we really want the child to be integrated with his family and for the family members to use the language that is richest and most appropriate for their family. And so I think understanding what the family environment looks like is a really important component as well.
All right. I think that will be helpful. Thank you very much.
Sure, thank you.
Does anyone else have any other questions? Okay, well, they have their emails up on the PowerPoint, and so feel free to email or email me, and I will forward on any questions that you might have. Well, thank you so much today for coming. We really appreciate it.
Thank you for having us.